Okay, I'm Joyce Scallett. My husband is here to have the surgery. We drove here from Central Illinois, and we were quite excited to find out about the procedure. It seemed like exactly what we were looking for.
When I had my PSA checked this year, the numbers had gone from 2 point something the year before to 8.8, and I got a little concerned that something was fairly aggressive. So I wanted to proceed with something to not treat the cancer, but to cure it. And so I looked at everything that I could find, having discussions with the medical people about HIFU and about the Da Vinci robot and the complications and the actual procedure and what you have to go through. And then I found this site, and it was just like the Lord told me that this is what I should do. So I immediately, the next day, made an appointment to come see Dr. Sperling.
My name is Dan Sperling. I'm an interventional uroradiologist.
And of course, I'm Dr. Steve Cianti, a specialist in prostate cancer ablative surgery.
So right now we have a patient, actually a 70-year-old male, who has local Gleason 6 prostate cancer in his right base. He's very amenable to what we do. We do focal laser ablation, and we can eradicate just the tumor focus while preserving a lot of healthy surrounding prostate tissue, preserving the patient's sexual function as well as his bladder function and his urination.
So the patient's had advanced diagnostics with a multi-parametric MRI study, and now we have a good idea of the three-dimensional aspects of his lesion. And using that information, we'll plan to do a three-dimensional ablation of that lesion with MRI laser ablation today.
My name's Andy. I'm from the company Visualize, which is the manufacturer of this workstation. We use this software to be able to watch the ablation in real time. It's the first time the marriage of MR and laser have been put together to create a very controlled, precise ablation zone.
Good morning. My name is John Gentile. I work with Dr. Sperling and Dr. Cianti. I am the MRI technologist that they use exclusively, and basically we're doing a laser-guided ablation of the prostate today.
Well, the patients have received a prostate nerve block, and we've now done the setup for the procedure. We've prepared the template, and so the patient is now going to come into the MRI magnet, and Dr. Sperling will obtain a series of images, and we will outline what we call a region of interest, the area where the tumor is, and from there we'll begin to plan our treatment. Well, today with our gentleman, he's having a focal MRI-guided laser ablation. So really, he's had a biopsy that's confirmed cancer in a region of the prostate. Now, with multi-parametric advanced MRI imaging, we can see that his tumor in 3 dimensions is really confined just to the right side of the prostate, and the prostate's approximately 1 centimeter in size. So he's ideal for a focal ablation. The MRI-guided laser ablation gives us a very precise way of creating destruction of that lesion, with the MRI software giving us temperature maps, so we can tell that the area that we want to ablate in fact is achieving lethal temperatures, and most importantly we can tell that the structures that we want to preserve are being kept in safe temperature zones.
Just trying to make it comfortable. So.
Yeah.
Steve, this was your
Just make sure it was an extra centimeter down to catch this. 0.3 is
On the biopsy, that's Gleason 7.
how far down?
It has to be because...
Good MRI of the prostate gland, and what you can see here is we develop a color map which shows us angiogenesis, which means rapid formation of arteries, veins, and capillaries in tumor tissue. And we know that the capillaries in tumor tissue have extra leakage. So if you see the red area is actually almost like a bullseye. It shows exactly where tumor tissue would be in this prostate gland here.
What he does have is
1, 2, 3. Got 'em all.
right side, I believe. It has small volume 6. That region right there, and typically that's a very.
And then, after this.
And now let's just go from urethra to here. Urethra, right? And now let's go to the center of that circle.
1.5.
Okay, so we can probably move this one up anterior a little bit because we want to get away from the posterior cap, away from the rectum a little bit. And yeah, yeah, just like this.
All I can do is take care of this.
And then we'll do, we should also do a post-contrast coronal to
Yeah, yeah.
feel for this. So now we've done MRI images for planning as well as imaging the transperineal template, and we're going to line up the grid of the template, particular holes in the grid, to insert the laser fiber directly into the lesion or the area of interest that we want to ablate.
So now Andy is aligning the template with the MRI image, and we've got 3 what we call fiducials or markers built into the template, which we align with the MRI image. This is exactly how GPS works in terms of finding any position in space from 3 known points. So now we're just teaching the system how to recognize the grid and get in the complete alignment, and that's going to allow us to put a laser fiber directly into our target. Sperling has identified the area of interest for our first lesion. We've now placed some local anesthesia through that area so there's no discomfort, and we've placed a needle into our area of interest, and we're just verifying position of that needle. That will confirm that we are exactly where we want to be. Then we're ready to place our laser fiber once we've done that and actually perform the ablation. So this is a procedure where we have to really aim, and finally we'll do our lesion destruction.
So right now we're doing an active laser ablation with real-time thermal feedback. And as you can see here on the screen is we create safety zones around structures we happen to be near the urethra, so we're going to protect that from with a safety threshold. And we have actually a cursor directly on the target area, and we're going to measure very sensitively small temperature changes until we can make sure we ablate the tumor and destroy it, but with a very safe transition zone and measurement of those actual heat changes. So we're doing our first ablation now. You can see right here this bright area is showing us exactly in real time which area of the prostate gland we're using thermal ablation on, and we can tightly control exactly how much tissue we ablate. And you can see around here these are different measurements of temperature surrounding this area of ablation. This measurement here is the temperature at the center of the lesion, which is 73.9. And these other markers are showing areas around the lesion where we want to protect and make sure there's no overheating to damage any sensitive structures. So we've measured and localized exactly where our lesion is. After we did that, we placed the transperineal template or a grid to localize exactly what we had been seeing on the MRI on the patient's body, and to be able to insert the laser fiber directly into the lesion itself. We put the laser fiber into the lesion, we confirmed our location with MRI imaging, and then we began to replace the actual marker with a laser fiber and began our ablation. The ablation so far has been very successful. We've ablated the majority of the tumor, and we can do confirmatory imaging after this to make sure that we've effectively necrosed any existing tumor tissue there and there's no more blood flow.
We've now completed the ablation of the right side of the prostate, and we've given the patient a contrast agent called gadolinium that shows blood flow. So as confirmation that we've destroyed the region of the prostate that was our target, the gadolinium will show a dark area, an area that's devoid of contrast, devoid of blood flow. And so Dr. Sperling is going to show us on the screen the area of the tumor that's been destroyed.
So you can see here the contour of the prostate gland, kind of shaped like an ice cream cone here. And this dark area of circle is showing us where there's no blood flow, which again shows it's devoid of blood flow. The tumor tissue has been eradicated, and in terms of following up this patient, we have a very nice delineation of exactly how much tissue we've destroyed. So we had a fantastic result. The patient is very comfortable. Right after this procedure, we're going to just watch the patient for about 10 minutes or so. He's doing very well. As long as everything continues and as we expect, he'll be going home and can resume his normal everyday activities with no restrictions, no catheter in place. We expect to have a fantastic result. There's no more blood flow to that area, and we've eradicated the tumor. Okay, now we need to follow you every few months and make sure there's no recurrence or nothing comes back. But this is a fantastic result. How are you feeling?
Better.
Better.
Better now that I'm not.
I mean, now you can go home, relax. You urinated, everything's functioning normally, and have a nice night. And we'll call you in a little while and see how you're doing.
Okay.
Okay. It went beautifully. Really, very, very well. He's comfortable. He's going to come in.
Yeah.
You guys, if you're ready to go home, that's totally fine, and we'll follow up in a couple of months.
Walking around back there, he's getting dressed.
Great.
You'll be ready to take him somewhere. Just have a good day and
And
relax.
we can forget about this now, right?
Looks good. It looked really good.